What do you think was the lead in your conversation?
Well, I think there were many. It was a very informative conversation, and Dr. Fauci shared some real wisdom and insight from his vast experience in infectious diseases and pandemics. One thing I would mention is our public health infrastructure in the United States. Dr. Fauci talked a lot about that. You know, we only about 3% of our healthcare spend is on public health, and our public health infrastructure has really eroded over the years. 5 decades ago, it was much stronger when we still had many infectious diseases in our midst. And then, perhaps due to our success in eradicating many of those diseases, that infrastructure eroded. We have to rebuild it now, and we have to rebuild it at all levels, the federal, the state, and the local level, because public health is a federated endeavor. It involves guidance from the federal government, from the states, but it's implemented at the local level. And all of those infrastructure methods and elements need to be rebuilt, and rebuilt as quickly as we can.
Absolutely, in a hurry. I wonder, I mean, he mentioned the LA school decision yesterday in that bit of sound that we played. I wonder how that conversation expanded in the chat and what your own view was on some of the decisions from public schools in California.
Well, we talked about bringing things back on, reopening, is not like an on-off switch. Governor Newsom has described it as like a dimmer switch. Things are going to have to be turned up, then turned down. In California, things were turned up, perhaps in some areas more quickly than was needed for public health. And so now they're going to have to be turned back down. And restaurants, in indoor restaurants, movie theaters, things like that are going to need to be shut until we get the incidence of the cases lower than it is right now. Those are some of the principles, I think, guiding the reopening. As the quote at the beginning of this segment from Dr. Fauci indicated, we shouldn't go back to completely shutting everything down, but we're going to have to be very prudent about restoring, reopening, and then moving on.
Yeah, Dr. Miner, this is Morgan. I understand all of that. But in terms of the case or the argument specifically around school reopenings, we have had, for example, many daycares across the country that have stayed open or have found ways to open and navigate and have been deemed essential because of healthcare workers, for example, that need to have a place for their kids to be watched right now. And I also realize that the data is still being collected and the research is still being looked at and assessed where children and the impact of COVID is concerned. But in general, there does seem to be many case studies out there of many other countries that have been able to reopen schools. What does the science tell us so far, and why has this become so politicized?
Well, what we do know is that for most children, COVID-19, if they do become infected, is a mild infection. There is a multi-system inflammatory condition that has been reported in several hundred children in the United States, but that is fortunately rare. But we have to also remember that in the school environment, there are teachers, there are food service workers, there are custodians, many of whom are at much higher risk of severe consequences from an infection. I wouldn't want to second-guess the decision that the Los Angeles district or the San Diego districts have made in deciding that they need to start online. But those are the types of data points, along with the prevalence of the virus in the community, how rapidly it's being transferred and spreading from one person to the next. Those are the types of data that public health authorities are considering, I believe, when they're looking at when to reopen schools and how to reopen them.
Doctor, what about to colleges and universities, including the one, of course, that you're associated with? Their financial future, to some extent, really will rely on students showing up on campus. Perhaps not some of the wealthiest universities, but many others. And we're seeing a diverse sort of group of approaches here. What do you think is best, and how much does it depend on where the university is actually situated in terms of state and even in terms of rural versus city?
Well, you mentioned some very important factors, and certainly here at Stanford, it's something, all those factors are something we're monitoring on a daily basis. We have announced that we hope to bring freshmen and sophomores to campus, or at least to have that as an option for freshmen and sophomores during the fall quarter. But it's not going to be a normal quarter. Most of the courses will be online. We'll have to have definitely social distancing, masking, other safety precautions in place, as well as the implementation of testing. All those protocols are being worked out today, but we for sure want to protect our students, and we want to protect the people who work with our students as well.